This video will be about shadowing before you get into medical school and what that will look like for you. We'll talk about why it's important, what to expect, and how you can potentially find opportunities. While it is tough to put a number on how many pre-med students shadow, a 20-year-old study found that around 80% had shadowed at least once. So while this may not still be the number, the fact that so many have shadowed means there is bound to be an opportunity for you if you know where and how to look for it. First, let's briefly go over what shadowing is really like. It is mostly observational, where you will get to follow a physician around, stand in patient rooms during exams, and just watch everything they do. Most physicians are actually really open to having people shadow them because it is an opportunity for them to teach an interested student without having to worry about liabilities, since they are still the ones performing the exams or doing the procedure. Shadowing is one of the few ways before medical school that you can gain clinical experience. While there isn't a specific length of time you need to complete, most people recommend that you shoot for around 100 hours of shadowing by the time you apply. It's around the length of time that shows not only a substantial amount of clinical experience, but commitment as well. It's also an added bonus if you're able to get shadowing experience in multiple different fields, and we will talk about that later, but it isn't a requirement. Finally, it's important that you try to start shadowing early. Similar to volunteering, shadowing is something you can start doing much earlier on, and it will still look just as good on your application. During my resume video, when I go over the shadowing section of my resume, some of those hours were actually done while I was still in high school, and they managed to still be valuable on my application, so keep that in mind. When you shadow, there are two categories of physicians, non-surgical and surgical. Each of these will have different expectations of you while you shadow, so they are important to go over. For non-surgical physicians, your experience will most likely be entirely inside of an outpatient or inpatient clinic. When you shadow, expect to dress professionally. For guys, that means dress pants and a tie. For girls, that means you can wear something like a dress with closed-toed shoes that you can walk around in all day. Be attentive and constantly ask questions when you are curious or don't know a specific terminology. Healthcare people love their medical jargon and acronyms. Because there isn't surgery involved, you will have the opportunity to get close when the physician wants to show you something, and if you are lucky, get a chance to try things for yourself. For example, if the doctor is testing the strength of a muscle or doing the patellar reflex, ask if you could give it a try. Don't expect to do too many things that are hands-on, but for the super non-invasive things that aren't too personal, see if you can try. Surgical shadowing, on the other hand, is completely different. You should dress the same way, but expect to change into scrubs in some hospital locker room before you go into the OR. It might be difficult while watching a procedure to ask a bunch of random questions, so instead, ask the physician to explain what they are doing in the surgery as they do it. Maybe sometimes they will point at something and ask if you know what it is. Don't be discouraged if they ask you something and you don't know the answer though, since you aren't even in medical school, and I doubt they actually expect you to know some of the answers. But if you do, it might impress them. You should be as observant as you can be, but since you are in the OR, you probably won't be able to get too close to the operating table with all the other people in there. The number one rule of shadowing in the OR is do not touch anything. Even if you have gloves on, don't touch anything. You will contaminate the field and force the surgeons to completely throw everything away and find new sterile equipment. One final thing I will say about shadowing a surgeon is it's a great chance for you to see if you can stomach surgery. We will talk a little bit about this later, but it is important that you know what you are getting into. So within those two categories of physicians, there are even smaller categories which are all the fields of medicine. You should really just follow your personal interests when deciding what field to shadow in, because at the end of the day, it's all clinical experience and med schools don't really care what specific specialty you shadow. If you aren't able to get into a field you like, honestly go shadow in whatever field you can, just to get the experience. You can also try to shadow in different fields, which might look beneficial on an application. If you show medical schools that you are trying to understand all of the aspects of responsibilities that physicians have across multiple specialties, it might be a stronger showing of clinical experience. However, this is not a requirement by any means and only serves as a benefit if you are able to do it. It won't hurt you to just shadow in a single field. All of my shadowing hours when I was applying to medical school was done with orthopedic surgeons, so I didn't have the opportunity to pursue different fields. There are a few things you should know about the day of shadowing when you start out. I've highlighted the most important things in red here, but you should expect early mornings and you absolutely need to be there on time. Being late to a shadowing opportunity not only looks bad for you, but might limit what you're able to see if a procedure starts before you get there, so plan accordingly. You should also be ready to be on your feet most of the day since you'll be walking around clinics or standing in the OR, so make sure your shoes aren't too uncomfortable. A lot of physicians will encourage you to take notes so you can learn and remember the things they show you, but it's important to not do that in the room with the patient. All of your time spent with patients should be opportunities for you to talk with them and be attentive. Rather than having your head down in your notes, use it as a chance to practice talking to patients. At the end of the day, good doctors need to be good at chatting with people, so this could be a chance for you to work on those skills if you need. Finally, if the doctor is having to do an examination that might be more personal, don't feel offended if you're asked to leave the room by either the patient or the doctor. You are still just a student after all, and the patient's comfort comes first. Remember, what you are doing is just a privilege, and the patients should still be the first priority. I think it is kind of self-explanatory why medical schools like seeing students that have shadowed, but beyond just the clinical experience you are getting, there is more to it. You are getting a first-hand look at the responsibilities of a physician and understanding what a day in the life looks like for them. Sometimes, when people want to become a doctor, they have this idealistic image in their head of what a perfect life might look like as a doctor. But the reality is that it's a lot harder work than people give it credit for. So, by shadowing, not only are you showing commitment to the practice, but it's an excellent opportunity for you to personally confirm whether medicine is something you still want to do after getting a first-hand look. I bet you will still want to, though, since shadowing can be such a cool experience. Another benefit to you from shadowing can actually be the potential of getting a letter of recommendation. I talk about this at length in my video on letters of recommendation, but the letter needs to come from someone that knows you well. If you spend multiple hours shadowing a physician, that could be an excellent opportunity to gain recognition from someone in an impressive position. Finally, let's end by talking about how in the world you even find shadowing opportunities. Unfortunately, they are a bit more on the difficult side to find when compared to something like volunteering, but it is totally possible. Try to use any family or friend connections to a doctor and ask if they would be willing to have you shadow them. Chances are, if you are on a friendly basis with a doctor and let them know that you are thinking about doing medicine, they will tell you to come shadow them sometime. If you aren't one of the lucky ones, like I wasn't, your next step should be to go through your professors at school. The doctor I ended up working with and doing research with, I only met through the professor I did research with at my college. So keep that in mind, that the door to a shadowing experience might be behind getting close with a professor of yours. You could also go to your guidance counselor or pre-med counselor if your school has one, and ask them for any additional assistance in finding an opportunity. When you finally do find a physician that might let you shadow them, it is important you ask them in the most polite and professional manner that you can. You don't want to start your email with "hey" or anything like that. Get your parents or professors to help you draft a professional email if you haven't sent many of those before. When you are finally given a chance to shadow, coordinate with the doctor or his or her assistant to see if there's any paperwork or training you have to complete before getting credentials at that medical facility. The last thing you want is to show up for shadowing but not being let into the OR because you forgot to sign something. Okay, I will end by just quickly mentioning that one opportunity could lead to another. A great way to get more shadowing experience is to ask the physician you are already observing if they have any colleagues that you could also shadow. Or, if you are interested in a particular field, see if they have a connection with someone and could get you set up. Once you have your first connection with shadowing, it's actually very easy to get many more after that. It's just all about getting that first opportunity. And that's everything about shadowing. It's excellent clinical experience that shows commitment and allows you to explore the real world of medicine to see if it's still something you want to pursue through all of that hard work.